Hi, I'm H9N2 to the third. You can call me Pandy, which is short for pandemic flu. Yep, I'm the little bugger that's just waiting out there for just that moment to occur. Infected migratory birds pass me along to poultry and other livestock. It's in these crowded types of conditions that I like to mutate, and sometimes I infect human beings.
Pandemic influenza is different from what we generally call influenza. Pandemic is different in that it's a new virus that starts infecting people. It's not a virus that's been around a while, and so we're familiar with it. So it's a totally new virus that develops and then infects people. Generally, the viruses tend to develop new genotypes rapidly. Their life cycle is so short and quick that they're always mutating and developing new strains of virus.
You know, many organizations have planned for disasters and have extensive implementation plans. While these are essential for disasters, they will prove inadequate for pandemic events, such as an outbreak of me. Experts say a pandemic will feel more like a war or a severe economic crisis than any earthquake, hurricane, or act of terrorism. A threat from me means that every corner of the globe and every element of society will be touched.
Oh, it certainly can affect millions. In the early 1900s, the largest pandemic happened and millions of people died as a result of that.
Susceptibility will be universal.
Part of the problem is we do have vaccines that were developed for the more common infections we see every year, and that's why we encourage people to get flu vaccines. But when a pandemic starts, obviously we are unaware of this new virus that's evolved, so we don't have a vaccine that can protect you.
Illness rates will be highest among school-aged children. Among working adults, an average of 20% will become ill during a community outbreak. In a severe pandemic, absenteeism could be as high as 40%. Typically, the risk of transmission is greatest during the first 2 days. Children will play a major role in spreading this disease.
If you're sick, avoid going into work and exposing other people. If your children are sick, keep them out of school.
Isolation and quarantine measures are likely, as are mandatory restrictions on domestic and international flights. Epidemics will last 6 to 8 weeks in affected communities, and multiple waves will occur.
Usually during a pandemic, the mortality rate's 50%.
The real heavy lifting will take place at the community and individual level. Communication will be key in saving lives and preventing disastrous impacts on the economy. A few questions to ask yourself. What types of face masks are adequate, and where can I get one? What are the guidelines for social isolation, coughing etiquette, and public gatherings? What responsibilities do local businesses have? Plan for the possibility that usual services may be disrupted. Stores may have limited supplies. Transportation may be interrupted as well. Store 2 weeks of non-perishable foods, selecting foods that do not require refrigeration, preparation, or cooking. Store 2 weeks of water, 1 gallon per person per day. Store them in clean plastic containers. Avoid milk cartons or bottles. Have a plan. Talk to your employer about staggered shifts, working from home, or telecommuting. Talk to your teachers, administrators, and parent-teacher organizations about the school's pandemic plan. Plan for entertainment and recreational activities that your children can do at home. Talk to your healthcare provider about medical supplies you should have on hand. What can you do right now? Well, you could wash your hands often with soap and water, especially after you cough or sneeze. Or if there's no water available, use an alcohol-based hand cleaner. Avoid contact with people who are sick. When you are sick, keep your distance from others to protect them. Try not to touch your eyes, nose, or mouth. Germs often spread this way.
In general, again, it's washing your hands good if you're exposed to public, avoiding crowded places. Crowding is a main factor in transmission of any communicable disease. So those types of precautions you can take.
Knowing the facts is the best preparation. I'm Pandy saying goodbye, and I hope we don't visit.